And we will move on to our debate, this morning's panel discussion, where we will build up on all the results that have been presented and some of the points that have been raised. And in order to do so, I would like to invite Maren Jochimsen, who is a member of the Executive Committee of the European Platform of Women Scientists. She's also the Managing Director of the College of Gender Research at Essen University, and she's the co-founder of the Network Caring Economy. So Maren, please join me here, as well as Dr. Angela Kaida, who's a scientific director of the Institute of Gender and Health at the Canadian Institute of Health Research. Good morning. And Ineke Klinge, who's president of the Dutch Society of Gender and Health. She's also the rapporteur of the Horizon 2020 Gendered Innovation second edition at the European Commission for the Director General Research and Innovation. I'd actually like to ask you to move up one seat. No, you can sit there, and Maren maybe, or whatever. I mean, it's just better if you're all close to me rather than out there in terms of camera, so that there isn't a gap between us for those who are filming us. So thank you very much for joining me for that panel discussion. And before we return to our audience for questions, what's your main take, or maybe your main remark, or a couple of points maybe on all we've heard already this morning? What reaction did it trigger in you? The points that have been made, the results of the discussions, the results of the research. Starting with you, maybe, Inge.
It's Ineke.
Ineke, sorry. Well, there we are. That's it. So,
no, it's so many people.
Exactly.
Make it
yes.
Klinge. That's a nice alliteration. Okay, but it's Ineke. It's a very Dutch name from the 50s. Yeah. Well, I think we have a wealth of data, and maybe it's already connected to your first question you asked us. How do we integrate all these data into healthcare? And it reminds me of an expression made by a colleague from Switzerland. It's Elisabeth Zempt, and she also said, when confronted with a wealth of data, where do we go with the knowledge? So we have been producing knowledge and much knowledge. So where do we go with it? How can we assure or guide that it somehow lands in clinical practice, in education, in communication? And well, it's an intriguing question, and the answer is it will not automatically land where you want it to land, and it's not a process of its own. So we have been writing with some of my colleagues about it. What is in basically the issue of implementation of knowledge, and then there are many stakeholders involved where you have to address to researchers, biomedical doctors, politicians, policymakers, people in the community, lobbying organizations, and well, of course, I think a scientist is trained to produce knowledge, and the expertise of landing the knowledge at a place where you want it to land is specific expertise. It's the science of an implementation science. So it's very difficult, and often it stops with for a researcher when having produced the articles or the science or whatsoever, and then money is ended and there's another project. So there's a real important issue to address, how to better secure implementation of the knowledge that you are making, and to involve people, experts, experts in implementation issues right from the beginning. And that maybe is a little bit also an answer to that question from the Ministry of Estonia yesterday, that they said that they won't data that they are looking for and not data that researchers are producing. So with this twist to have the people that will use your knowledge involved from the very moment is maybe and also another avenue. Mm-hmm. So for a first.
Yeah, thank you. Yeah, well, I mean, Ineke has actually anticipated my question, but no, but that's okay. But still, if you have some maybe feedback on the results of this morning's studies, and then indeed how you see, how you think we can better integrate the results that we've been hearing about and take them into account to actually improve the healthcare systems.
Okay, thank you. You can hear me okay?
Yeah.
So I'll start with your first question just by reflecting on the presentations that we've seen over the last 2 days. And first, just really to congratulate the teams involved, because first of all, undertaking international collaborations for science is no easy task. I don't need to tell you that. But the structural barriers behind that really kind of compromise that work require a lot of dedication and perseverance. And so genuinely just to congratulate all of these teams, because I think the findings that we saw today are just so important. And if I'll answer your first question first, and then I have a lot to say about your next questions. But I think the first point is that incorporating sex and gender is better for science. So some of the questions around incorporating gender and sex are about some equity questions, and yes, that equity is the eventual goal, but what we saw here is the precision that we were able to discern from these analyses just showed us that if we hadn't had a sex and gender dimension to this research, what we would have learned would have been like less than half of what we actually learned here today. It's not just about showing that there are differences by sex and gender, but there are different mechanisms of effect. And I thought that was such an exciting part of what we've seen and talked about over the last 2 days. And then maybe my second reflection on these particular presentations has been about methodologies. And I think we've just been exposed to such sophistication in how we can analyze the data that's emerging that has a sex and gender dimension. So it's not just the regular, stratify by sex or gender, include sex or gender as a confounder, which is for the large part what a lot of statistical analysis does. And I think what we saw here today is really new methods that can allow us to interrogate that data in more sophisticated ways. So I'll stop there. I think there's a lot more to say, but just reflecting on those presentations, those are two things that at least come out really strongly for me.
Maren.
Yeah, thank you. Can you hear me? Okay. Also for me, I would say, and I come from a slightly different perspective, a lot of it is there. It's probably also there, also in the last discussions and in the discussions yesterday, a lot of issues were addressed. And I would say there's also a need to integrate these pieces of knowledge. And the background I'm speaking about, and that was said before, I'm the managing director of the Essen College of Gender Research. It's an international research institution, central research institution of the University of Duisburg-Essen. We have members from 7 different faculties, which actually is members from 20 different disciplines. And one unique selling point is that we have members from the medical faculties among them. So this is not a separate gender medicine research institute. So that gives us a unique chance to discuss what is the measure, so where do sex and gender meet? What's the main influencer, can you say so? And in our collaboration efforts, one thing over the years we did is develop an integrated model of multi-dimensions of gender. So that is the structural dimension. You also address this, the socioeconomic factors, that's the access to resources, that's agencies and institutions. And then there's a symbolic layer, that's the stereotypes for example. Then there's a subjective dimension to gender. This is how I appropriate it as an individual. And all of these, and if I was going to piece together what has been said today, they were all elements. But then, and this is what we incorporated, and most of us come from a social science perspective, then the bodily dimension or the biological dimension. And all of these interact. And the trick is they do not only interact in patients, they interact in doctors, they interact in researchers, they interact in those who write research programs. And I think the interesting thing is now, and this, your project were about this, how can we piece down, is there any first? So, for example, the cancer treatment, we know that, and so where to begin? The cancer treatment, at least to my knowledge in very parts, is developed with male probrands. And so there's a known effect that it has a different effect on smaller bodies, on lighter bodies, on female bodies with different kinds of processing medical treatment, for example. So do we, in a sense, do we need to fix this first and then study how the other things come in? So this is an example of what is it? Is it our treatment in the first place and the lack of knowledge that we have on biological issues, and then we have the other factors, and there might be other examples where the other factors, the gender factors, prevail. So I think this is a really interesting discussion, not to kind of look for reasons maybe in fields we do not need to look first.
Angela, you've been nodding at what Maren was saying, and so were you, Ineke. Would you like maybe to add something to her particular point?
I mean, I think she's made the point very convincingly, and I just really, I think I'm nodding because I see this as a pipeline, right? So from the very beginning, as we can conceptualize research questions, objectives, like the sex and gender dimensions need to be there all the way through, like right from that conceptualization, because at the end of the day, we need that sort of theorizing, that conceptualization, that data collection, that analysis, that interpretation, that, you know, drug development, healthcare system delivery, like that is all a connected process. So starting the work with the sex and gender considerations is essential. I don't have to tell you, it's absolutely essential. I guess I'm going to kind of segue a little bit, because I think a second part of this thinking is around how in the research ecosystem can we foster these types of approaches. And I'll share that, you know, from CIHR, the Canadian Institutes of Health Research, we mandated probably, I should know this, but like 10 plus years ago, that all funding proposals needed to consider sex and gender. Okay, or everybody submitting an application for funding needed to specify, hey, how have you considered sex in this proposal? Second question, hey, how have you considered gender in this proposal? So that's mandatory. You have to answer those two questions. And so that's a good start, right? We can talk about where does that actually end up. But certainly we know a few things. The proportion of proposals that do at least speak to gender and sex have increased, right? So we have, I think it's something like it started in 2011 at 14% for sex, and now it's 70% consider sex. And gender hasn't increased as much, but of course, if you're working in basic sciences or with cells, you know, maybe gender is not the question at hand. But we have seen that requirement has increased how at least people applying for funding consider sex and gender. But I would consider that like a first step, an entry point. But the additional levers in the funding system also have to be activated. So for instance, there's a peer review panel, right, or a peer reviewer. Are they able to look at a proposal and say, oh, yes, this is a good integration of sex or gender or not, right? That's how we get funded. And so there's an entire investment in the broader research community to ensure that not just the applicant, but those who are reviewing these applications are similarly able to adjudicate. And I think as we saw from Dr. Pilat's or Dr. Rochon's presentations in particular, it's a sophisticated science to include gender and sex considerations. So we have this tension between saying it's a very sophisticated science that runs deep and it's complex and there's an expertise, but at the same time requesting that we have every health sciences proposal can make these considerations. So I have more to say about that. Maybe that'll be a lunch break conversation. But I do want to kind of raise that as a tension in the work that we're doing. How do we say that everyone should do this and also at the same time agree that there's a sophisticated, complex expertise necessary to do this science in a good way?
Ineke, would you like to?
Yes, a short reflection, because Maren triggered that in me, is about we have to be aware where we as biomedical scientists, or me personally as a biomedical scientist, learned about gender, and that's from the social sciences and the humanities. And so we need to be aware that also that for them, gender was first. That was first. And, well, biology was more or less neglected and whatever. So coming from biomedical sciences and in my second education or environment in gender research, then I always advocated for, okay, but there is biology. And then just to finish it quickly, when they said, my social and humanities colleague said, okay, but then gender influences biology. And I said, okay, I want to believe it, but how? What is the mechanism? And then finally, when in biology and in biomedicine, the process of epigenetic regulation came to the light, was discovered in a way, then I could understand how gender influences sex. But I think that was only relevant for me and not for the social science. They believed it anyway. Okay, sorry, just a little anecdote.
Sorry, just a little health break there. Do we have questions from the room already? No, not at this stage. We have had a request from one of our online viewers, and actually we could start with you. It applies to all of our speakers. It's a request to clarify the notion of gender when you start presenting the results of your research, but also maybe that could apply to you, because it's a notion that you use in your daily work. So maybe starting with you, Ineke.
Okay, that's I've been my notion of gender has been evolved over the years, and now I'm most comfortable by seeing gender not as a trait, but as a process, and it's a process, a multi-level process, or multi-dimensional concept, where you have the level of gender norms that are pervasive in society, the level of gender identities, and the level of gender relations. And I know that some colleagues also have the level of institutional gender, where it's about power relations between persons and society and structures in society. So a multi-level concept.
Angela. Or Maren, I mean.
Okay, so I mean, I think this is just such a great question, and it's something that we engaged with yesterday after hearing some of the presentations about. I think we actually all have quite different understandings of gender, and I really think about gender as Ineke has already described, as inclusive of gender identity and gender norms and gender relations, but I would add in my conceptualization of power. So gender to me has a lot to do with systems of oppression and power, and the power that we have by gender to influence our health decision-making, to influence the spheres in which we can access information, that influence what's expected from us in terms of our behavior.
The mic a little closer,
in terms of our behavior. So that and for me, I think of, and I've heard this differently from my colleagues in the room, is I think of the reality that our gender intersects or butts up against other forms of of power or oppression and identity to create other systems of access. So I think about sort of race and racism and ethnicity as a separate feature that can interact with gender, or class and classism and poverty as a system that can interact with gender. But I've come to hear from others in the room that the construction of gender for some already includes those social determinants. Does this make sense? Yeah. So I do think it's such a great question to put in front of us. So
it's probably a question we should have raised first thing yesterday, but then we'd probably still be talking about it. So I suppose there are as many detailed definitions as there are researchers in the room, even though we're probably going to find some broad lines of agreement. Maren.
Yeah, maybe I just add to what has been said before, including what I said about the different dimensions. It's socially constructed norms, roles, relationships of power and status and hierarchies. I think this is very important behind it. That was meant with the inequalities. It's a concept, I think, that's not only meant to be descriptive, but it has an agenda behind it in the way of, I find this out, and if the distributions are too uneven, whatever they are, the inequalities, and I don't find a very good solution for it, I have the feeling I would like to change something about it. I also like to add that we consider gender as historically bound. Ineke said it's dynamic. So the gender arrangements or the gender relationships evolve in history and they change in history. And as researchers, and this is the tricky thing, science reacts, science comes from society, is rooted in society, so absorbs these norms and then applies them. So how do we prevent ourselves from seeing what we experience already? So how do we get behind it? How do we get behind seeing, for example, and there the stereotypes come in, the active male and the passive female, also in how I describe what I find under my microscope. And I think this is a very tricky thing. So our own lacks of either experience or cognition, do I only see what I experience, or can I see beyond? And then, of course, scientific results in their turn influence gender arrangements in societies. And if you look at some of the results we said, the researchers themselves said, we were surprised to find, this is not to say that this is due to the setup of the study, but why is that so? And I think from intersectional perspectives, there come some very refreshing insights, because if you switch cultures, for example, or surroundings, the gender concept is also culturally bound, then you get new setups coming in that are the normality for those researchers. How could it be otherwise than exactly vice versa to what you said or you saw yourself before?
Mm-hmm. Ineke, I think you want to add something to this.
A little thing, now that we have been diving into gender and the dimensions and the gender-related factors, which are multi-level. We've seen the screens by Louise also. Then I think the message for researchers is that you don't have to take that all into account, but you will be very you have to scrutinize your primary research question and then ask yourself, are factors relating to identity relevant here? Okay, then you take them into account. Are factors related to relations relevant here? Yes or no? So you don't have to do everything at the same time, but it very much depends on your primary research question, and then you make it doable.
Any question from the room? Yes? Okay, we have two questions.
Just a general question about policy implementation. So all of this healthcare work, particularly the studies which have been led by Canada, are very broad in their focus and they have a lot of very interesting results. I wonder how in a multi-institutional, multicultural study or multi-country study, how do we implement that as a policy? How do we kind of influence that at local levels? Is that possible to have a policy document which is actually usable across 4 or 5 different countries?
Another question for us, maybe it's a question for...
Maybe, I'm not sure.
Is it for the... I think, you know, you raised a point that it's exactly why we need to do this kind of study in multiple countries. Because in terms of the importance of certain gendered factors, they will change with time, you know, with culture, and then with the country you live in. So you will develop policies based on the results that you find. You know, for example, we found for like the prevalence of hypertension, the immigrant status appeared to be a stronger factor in Northern Europe than in Canada, for example. So if you're going to develop like a, a detection of hypertension, you know, in Northern Europe, you will focus on, you know, some immigrant. You try to reach out to immigrant populations, you know. So that's exactly why it's important to do translational research and identify factors that are proper to the country or culture or population that you want to have policies being applied. That would be my answer.
Angela?
Yeah, it's funny, I was going to actually ask that exact same question, because I think when I've been listening to the presentations over the last couple of days, that cross-country comparison, I think, would be so informative to the work that's been undertaken here. Because if, as Maren has already described, gender is socially constructed. It's bound by time, history, location, context. And so the opportunity that the groups have here is, oh, we've got 5 different countries involved. Does gender show up in different ways in the same scientific research question across these 5 different sociocultural settings? And if it does, what can we learn about something around how that society is constructed, right? You said we need to fix society, so how is that society constructed? What are the features present in terms of immigration policy or the prevalence of racism or other features that shape that outcome? And I would say that's kind of, to me, that's such an added value of the GenderNet Plus approach that I think we need to kind of capitalize on in terms of our understanding.
Ineke, do you want to add something? You were nodding as well, or?
No, that was intuitive nodding.
Yes, Maren?
Maybe on one of the notes, I think it's also interesting to ask yourself, what are you considering the norm? Which is another question of detecting, you know, what might be your blind spots. And I mean the norm, of course, for medical people in treatment, outlines, and it's not an easy question because it's about the reflection of your own standpoint. Or is the norm coming to immigration policy or other sorts of policy? Yeah, you have that in place. You have women shelters in place. You have that in place. And then what happens if that disappears due to economic constraints? So I think that's an important point. And even if there are cultural variations, we all know that there are some also similarities. I mean, there's very rarely any country that is exactly opposite, you know, where what we find is quite to the contrary. So, and this is also what we must be interested in. And as on the suggestion, we have to fix society. I mean, the gender dimension is about fixing the knowledge. And I think that was said yesterday. So the EU approach is about fixing the individual, so that where women before, it's now fixing the individual, then the structures.
Hold the mic a bit closer,
Oh, sorry.
apparently.
Fixing the individual, the structures, and then the gender dimension is about fixing the knowledge. And it was mentioned earlier, one important point is also how do we train our young, our early stage researchers? How do we teach our students? And I think this is a real bottleneck, at least in some countries. I come from a country, Germany, where it is a real bottleneck. And if you're interested later on, I can share how we go about it with my institution and our medical department and step by step. So how to institutionalize this question even before you apply for funding. because yes, we have a lack of data, but we also have a lack of awareness and a lack of training before. Even those who want to include it say, well, I've never been taught. I hear for the first time there's different reactions in male and female bodies to certain kinds of medication. It's not taught. So we start at a very late stage, so to speak.
Yeah, it is one of the points that were made earlier, actually. We had another question there. And then one at the back, yes. So Birgit and Mariano.
Thank you very much. And it's really nice to have the pleasure of having this panel right now. And of course, I'd like to take another opportunity to congratulate Dr. Kaida. She went through a tough competition in Canada to hold this post, and we have a lot of expectations out of you as Canadian researchers, so be warned.
Pressure is on. The pressure is on.
And I'm pretty sure you'll be up to the task. So the question is, given that we have a diversity of expertise and newer, from GenderNet work so far and, longer term as well, I just wanted to hear from each of you about, did you have a sense that in various countries of Europe versus, Canada, we do have a different definition of gender, and that, it doesn't really, I guess we don't really have to have the same definition across countries, depending on, as Louise was saying, and yourself, Dr. Kaida, about, what are the priorities of the country, and that we need to fit with the policies. But how do we then continue and work together, when we sort of have potentially different definitions of the main concept that's supposed to unite us? So I guess the question is really, how do we come around, the diversity, and at the same time make sense of it for our policies in the respective countries?
Okay, we'll take the question from Mariano as well, so that we can group them.
I have no other definition of gender.
Thank you very much for a very interesting discussion. I was wondering, I have been hearing for a lot of the projects here that have used secondary data of the limited number of variables, or even none of the variables that are actually measuring gender-related outcomes collected, that are not being collected routinely in our healthcare system or in any other system. And in Europe and elsewhere, especially in Sweden, we have very strong registers. But I was wondering, there are not enough gender-related variables there. So any suggestions on how can we actually push institutions to actually collect gender-related variables in a routine way so that we can use it for analysis instead of dropping our variables here when we get a grant, so we can follow it for some time, and then, of course, when the grant stops, then no more data is collected. Any suggestions on how to do that?
Okay, so
No suggestions how to do it, but if you don't have those data, you can. Well, then I think it's more clear, better to say, okay, we can't do this because we didn't collect the relevant variables. You've seen a lot of research groups now trying, especially also in my country, so I'll take part of the shame, to retrospectively analyze data which were not collected for that purpose, and then call that gender. Okay, that would not be the good thing.
And what about the first question? Did you have a point about that, about the difference of possible difference of definition?
No, today I have no other definition, nor in my head, nor in my work, of gender than the one I gave a few minutes ago. So is there any other definition of gender around?
Or different perceptions, maybe? Or
I've not to my awareness. Louise?
I think, Ineke, you gave a very appropriate and broad definition of gender, but many people use, even in our presentation, say the word gender but really mean gender identity. Say the word gender but they really mean sex. So the definition you provided is right, but the use of it, differs. There's no question about it.
Okay, there you have a point. But then it's not so much the definition of gender. Well, in our community, but maybe in society. And today, if I say I'm a researcher on gender medicine, I'm attending a gender medicine conference in Padova, and then I met someone at the bus station, and then a person said, okay, are you studying transgender? No. So that is the public perception now of gender that's about trans. Yeah, that's true.
Angela, so gender definition, if any, I think we've more or less covered it. But in case you have anything to add, and otherwise, how to make sure that data keeps being collected and we have reliable data sources.
I mean, these questions are actually so interrelated, right? Because I think the operationalization of measurement of gender is where we're kind of at, right? Like I think by definition, we have a fairly similar understanding of gender, but then what do we use to measure it? What is the question that we use or questions that we use? And I think that relates to Mariano's question. So how do we where in our administrative data collection do we measure gender, and what are the questions we're going to use to do that? Right? Am I understanding? Yeah. Yeah, so I guess I don't have a great answer to this, but maybe just for you, Maren, I think in the Canadian setting, there is quite a bit of growing work around how to do this better. So Statistics Canada, our national sort of aggregator of national data, have done a pretty bad job so far of collecting data that is inclusive of gender and other identity intersections. But they have a plan, and they're working on that. So that work, I think, will get better, and we'll be able to say more from these administrative data sets. I would say, again, coming back to the value of these types of inter-country collaborations, is that now if we can say, hey, Sweden has done this, they've done a super good job of it, like this is how they've done it, and we can take that back to our, the decision makers in our country, that's really helpful for us. Right, is to be able to say, here's a country that did it, this is the benefits of doing it, this is how they've done it, maybe this is something that Canada can also take on. So sharing those, I guess, best practices between different countries is, I think, a real advantage of these types of collaborations, and we'll be happy to learn from what you've done. The second thing I'll say is, that's a question that I think I get as a researcher a lot I do a lot of community engaged research from my community partners of like, how should we measure gender? Like, how are we going to do a better job of this? And I imagine at the Institute of Gender and Health, that's going to become a pretty big job for me of how do we inform the research community how to do this? And I think in some ways, folks want like just tell me the 5 questions to include, and I'm just going to include it, and we'll just carry on. But there's so much nuance. How are you going to understand gender in your specific research question? Who are you recruiting? What kind of, safety measures do you have for the participants that are going to be in your study that's gender inclusive and all of that? So it's not straightforward, I guess. What are the questions? But what I can offer, I suppose, is we do have a mechanism at IGH called what we call Meet the Methods. And it's a chance for us to showcase different methods, and maybe in this case it's about data collection on gender variables, that we can kind of summarize with some of the folks in this room. I know your group has done one on clinical data collection, right? So what is it that we can learn from the GenderNet Plus kind of collaboration that can help inform the research community? It's Canada facing, but it's internationally available around how to do a better job of collecting data. What are the considerations you might have? So I'll just offer that as like, I guess, a practical outcome that we can draw upon from the knowledge that we've gained here.
Okay, maybe one note also, and we had a similar discussion yesterday, how do research results enter into research political discussions, and thinking whom are we going to address at what level. And one important point is, and I think the EU is a very fine example of this, if a supernatural body like the EU goes ahead and does it, it has trickle-down effects in the national sphere. And for example, especially for the gender dimension in science, that made a lot of difference until today. You know, what EU programs are requesting, what statistics are being collected, because then the national programs at member state level, they orient themselves towards this, because eventually you always, in Germany at least, you have to justify why you're applying for national money and not for EU money. And then this needs to piece together. So I think, and this is then also where associations like the European Platform for Women Scientists come into play. I mean, the European Platform for Women Scientists is an association of associations of gender researchers, women researchers in all disciplines and institutions working towards gender equality and the integration of the gender dimension in science. It also has individual members, but the main orientation is towards these multipliers. And its identity or its missions is to be a structural link between the research community and European research policymakers. So what we do is we collect impressions from the research community, and then we try to feed them back into public consultations. We write position papers and alike. So we all need to keep on pressing. And someone said yesterday, governments have to put pressure on research funding institutions. Yeah, they also need to put pressure on other institutions, also on research institutions, and vice versa. For example, in the medical field, my medical researchers tell me that gender medicine is ages behind of what is happening in other countries. If you consider the mandatory request to integrate the gender dimension into research, now no country would want this. And then we come back to what Angela just said, it's actually a quality mark of research. So do you want to miss out of this as a country or not? And I think more of this argument also needs to be made. And I think the evidence collected here shows that, yes, we know more after this, even if we don't know how to act on this, or there's still, as Ineke said, a long way to implementation. But I always say on the gender lens, you know more specifics, but at the same time, you have a broader view, right? You look at it more closely, but that actually means you have a more encompassing result at the end. And maybe one last point, a couple of years back, we also started an initiative, my institution together with the European Platform for Women Scientists, called Ready for Dialogue, which exactly advocated for a dialogue between all these stakeholders, research funding institutions, the journals that were mentioned, research performing institutions, society, and so they should sit together, because it has to work together. You know, if Nature or the Lancet change their publication guidelines, you can go back to your research institutions or to your research funding institution and say, hey, you know, I can publish this. If you can't publish this, you can't have the researcher on her own in a world like this do interesting research that doesn't get out there. So.
A final word, Angela?
Okay.
Well, we're going to have to close,
Yes.
so.
Okay, then that's just maybe to say thank you, and I think there's a lot more to discuss, and I'm really grateful to have the lunch to do that.
Ineke.
Yes, I'm tempted to tell you a little interesting story, but I'll keep it for the lunch, which is about another way of implementation that we are now executing in the Netherlands, and that will not be a top-down thing to throw data on politicians, but that we have mobilized a bottom-up process, and it's called mobile brigades, mobile brigades, whatever. So from that idea that policymakers listen to people, to persons, instead of listening to researchers. But I can tell you more.
Sounds like a very interesting project. So I'm sure you're going to be surrounded by a whole crowd of people during lunch to explain your project. Thank you very much to all three of you.